At some point, every American retiree asks the same question. What happens if I get sick abroad? Not in a dramatic way, just quietly while looking at another insurance renewal letter that has gone up again, or sitting in a waiting room for 3 hours for a 10-minute appointment, or opening a medical bill that somehow costs more than a used car. That question, what happens if I get sick abroad, is the reason this video exists, because the answer for a growing number of retirees is actually quite reassuring. In some countries, the answer is you get seen quickly, treated well, and you do not lose your savings in the process. This video is going to look at which countries those are, not as a sales pitch, not as a fantasy, as a practical, honest comparison for anyone who is seriously considering this. Healthcare is the #1 reason American retirees hesitate to move abroad. It is also quietly becoming one of the strongest reasons they do. The United States has some of the finest medical specialists in the world. It also has a system that charges $800 for a hospital gown and sends you home with a bill that takes 3 years to dispute. The average American retiree on Medicare still spends roughly $6,000 per year in out-of-pocket healthcare costs. And Medicare, it is worth noting, does not cover you outside the United States. So the moment you leave the country for more than a short trip, you are on your own. That is the starting point for this conversation. Portugal has become the most discussed retirement destination in the world for a reason. Its national health system is public, well-funded by European standards, and available to legal residents. Once you obtain residency, which Portugal has made relatively straightforward through its D7 passive income visa, you can access the public health system. Wait times in the public system can be longer in major cities. Most expat retirees supplement with private health insurance, which in Portugal costs between $80 and $200 per month, depending on age and coverage. For that price, you get fast appointments, English-speaking doctors in most urban areas, and hospital facilities that are modern and well-equipped. A GP appointment in the private system costs around $50 to $80 without insurance. A specialist visit around $100 to $150. Compare that to the United States and the numbers speak for themselves. Portugal also has a stable political environment, a low crime rate, and the kind of weather that is genuinely good for your health in the first place. Spain operates one of the most respected public healthcare systems in the world. It consistently ranks in the top 10 globally. Legal residents, including retirees on a non-lucrative visa, can access the system after registering and meeting contribution requirements. Like Portugal, many expat retirees use a combination of public registration and private top-up insurance. Private insurance in Spain runs between $100 and $250 per month for a retiree in their 60s. The quality of private hospitals in Madrid, Barcelona and Valencia is genuinely excellent. English-speaking medical staff are widely available in major cities and coastal expat areas. Spain also has a particular advantage that does not get mentioned enough. Its Mediterranean diet, walkable cities, and outdoor culture contribute to a quality of life that reduces how often you need healthcare in the first place. That is not a small thing. Mexico deserves a more nuanced mention than it usually gets. Not all of Mexico is equal for healthcare purposes, but specific cities, San Miguel de Allende, Mérida, Puerto Vallarta, and the Lake Chapala region, have developed mature expat communities with corresponding medical infrastructure. Mexico has both a public system and a highly developed private system. Most expat retirees use the private system exclusively. The costs are striking. A private GP consultation in Mexico typically costs between $30 and $60. A specialist visit between $60 and $120. Many medications that require expensive prescriptions in the United States are available over the counter at a fraction of the price. Full private health insurance for a retiree in Mexico runs between $150 and $400 per month, depending on age and coverage level. Some retirees with straightforward health needs simply pay out of pocket and still spend less than they did on co-pays and deductibles in the United States. The quality of care in the private system in these specific cities is consistently reported as good to excellent by long-term residents. This is not healthcare tourism. This is day-to-day medical care that happens to cost considerably less. Thailand has been attracting medical tourists for decades for a reason. Its private hospitals, particularly in Bangkok and Chiang Mai, are internationally accredited, technologically advanced, and significantly more affordable than comparable facilities in the West. Bumrungrad International Hospital in Bangkok is routinely cited as one of the best private hospitals in Asia. It sees over 1 million patients per year, including a large proportion of international visitors. A consultation with a specialist at a top Bangkok private hospital costs between $50 and $100. Major procedures cost a fraction of American prices. A hip replacement that costs $50,000 in the United States can be performed in Thailand for between $12,000 and $18,000, including a private room and follow-up care. For retirees who need ongoing care or a planned procedure, Thailand is worth serious consideration. Private health insurance for retirees in Thailand runs between $150 and $350 per month. The country also offers a retirement visa that is relatively straightforward to obtain. The trade-off is distance from family in the United States, which is a genuine consideration and not one to dismiss lightly. But for pure healthcare value, Thailand is difficult to argue with. Costa Rica is the closest option on this list geographically for most Americans. A flight from Miami runs around 3 hours. The country has a well-regarded public healthcare system called the KAHA. Legal residents, including retirees on the popular Pensionada visa, can enroll in the KAHA system for a monthly contribution based on income. That contribution typically runs between $100 and $150 per month and covers a broad range of services. Private healthcare in Costa Rica is also available at reasonable cost. The country has invested heavily in its medical infrastructure, and San Jose has modern private hospitals with internationally trained staff. For retirees who want to stay within a few hours of the United States while still accessing affordable healthcare, Costa Rica sits in a category of its own. Malaysia is less frequently discussed but consistently impresses on healthcare metrics. Its private hospital system is modern, well-staffed, and considerably more affordable than Western equivalents. Kuala Lumpur, in particular, has several internationally accredited private hospitals that attract patients from across Southeast Asia. A GP visit in the private system costs between $20 and $40. Specialist consultations run between $50 and $100. Private health insurance for retirees starts at around $100 per month and rises with age and coverage. Malaysia also has a dedicated retirement program called the Malaysia My Second Home Scheme, which is specifically designed for foreign retirees and includes straightforward pathways to long-term residency. The country is English-friendly, has a stable infrastructure, and offers a cost of living that is significantly lower than most Western nations. It is not as commonly discussed as Thailand or Portugal, but it arguably deserves more attention than it receives. Before this starts to sound too straightforward, a few important points. Language barriers are real in some of these countries, particularly outside major cities. If you have a complex chronic condition that requires highly specialized ongoing care, the United States still has depth of specialism that most countries cannot match. Moving abroad for healthcare reasons requires advanced planning. You will likely need to purchase international health insurance before your residency is established. Medicare will not follow you. You need to factor in the cost of replacing that coverage, and proximity to family matters more than most people admit until they are far away and something goes wrong. These are not reasons to dismiss the idea. They are reasons to research it properly. This conversation is most relevant for retirees who are in reasonably good health, are open to change, and are finding that the cost of healthcare and general living in the United States is making retirement more stressful than it should be. It is also relevant for anyone approaching retirement who is doing the maths early and realizing that a different model might work better. You do not have to be wealthy to retire abroad well. In many of these countries, a modest social security income goes considerably further than it does at home. The United States has excellent healthcare. It also has a billing system that can undo a lifetime of careful saving in a single hospitalization. The countries on this list offer a different arrangement, not perfect, not without trade-offs. But for a growing number of American retirees, the trade-offs are worth making. Portugal and Spain offer European standard care with a familiar quality of life. Mexico and Costa Rica offer proximity, affordability, and more than adequate private care. Thailand and Malaysia offer exceptional value for retirees who are comfortable with a longer journey. The common thread is this: in all of these countries, healthcare does not feel like a financial threat. It feels like a service. That distinction for many retirees changes everything. If you found this useful, take a moment to like this video. It genuinely helps this channel reach people who are asking exactly these questions. And if you are seriously considering any of these countries, subscribe. We cover this kind of analysis regularly. Practical, honest, and without the sales pitch. There is a lot more to come.